Health Transformation Program aims. The Health Transformation Program, HTP, is modernizing benefit services to vastly improve customer experience, build trust in our services and the decisions we make, and create a more efficient service for taxpayers. The program is developing a new health assessment service and transforming the Personal Independence Payment (PIP) service over the longer term. The HTP will also support testing and implementation of proposals set out in the Transforming Support, the Health and Disability White Paper. https://www.gov.uk government/transforming-the-health-disability-white-paper. The program's key strategic outcomes are increased trust in services and decisions, a more efficient service with reduced demand for health assessments, increased take-up of wider support and employment, improved customer experience with shorter journey times, transformed in-house data and IT infrastructure that is secure. The HTP Theory of Change, TOC, provides a high-level overview of what we could change, how we could change it, and how we expect these changes to support the program's strategic outcomes. It will inform what the program is testing and the changes we take forward when scaling the service. The Theory of Change section looks at the TOC in more detail. This strategy sets out our current high-level approach for evaluating and tracking the performance of the HTP as a whole. Health Transformation Program Scope and Approach. In this section, we provide more detail on the new services that the HTP is developing, the difference these new services will make and the program's approach to developing them. The program is transforming the entire PIP service, from finding out about benefits and eligibility through to decisions and payments. As part of this, the program will make improvements to existing ways to claim and introduce an optional online service, providing customers with a greater choice over the channels they use to interact with the Department for Work and Pensions, DWP. The transformed PIP service will deliver a simpler application process for customers with more information and support available to those who need it, including helping them decide whether applying for PIP is right for them. Improved evidence gather will also enable the program to better tailor the service to the customer's circumstances. For example, they will only have a face-to-face assessment if this is the most appropriate method, and it may be unnecessary for the customer to have an assessment at all. As part of this, we are exploring a case management model, a personalized approach for customers from initial contact and throughout the application, including signposting to other benefits and services. This approach will help the program to better understand our customers, tailor their service, and help to build customer confidence and trust that their case is being progressed appropriately. Simplifying and automating the PIP journey and tailoring how the customer is assessed will mean many customers get a decision on their claim much quicker. Customers will be able to apply, upload evidence, track progress and see payment details online. Communications and notifications will be simpler and easier to understand, and for those on the digital journey, they will be available to receive and submit electronically, so that customers understand their claim decision and how the evidence they provided supported it. The program is also creating a single new health assessment service for all benefits that use a functional health assessment. This will eventually replace the different services we and our assessment providers use to undertake health assessments across all benefits, including new IT and processes. The health assessment service will be fully integrated with other systems, including the transformed PIP service, to create a seamless customer experience. By improving how we gather evidence and by enabling the reuse of information, the new integrated service will provide DWP agents and healthcare professionals with easier access to relevant information. This will reduce the burden on customers to provide complex information and reduce the need for them to provide it more than once. With around 2 million health assessments conducted each year, the nature and scale of the HTP's work is complex and ambitious. The new services represent a major change to how the department manages functional health assessments and how we support those who are applying for PIP. In recognition of these complexities, and the need to protect vulnerable customers, we are developing the new services at a small scale in a safe and controlled environment known as the Health Transformation Area. The Health Transformation Area is where we are exploring, adapting and learning from new ideas and processes. It provides the space to develop and build our services safely, before carefully and gradually growing the service. The program is procuring new assessment provider contracts, which will start operating from 2024. These functional assessment service contracts represent an important step in delivering our ambitious longer-term service reforms. They will provide the foundation for the new health assessment service, replacing the current health and disability assessment services and PIP assessments with joint services under a single contract for each geographic area. They will ensure continuity of service for customers while we safely develop the new service, providing the flexibility to introduce the new health assessment service gradually, before we roll it out nationally, from 2029. The functional assessment service contracts will support white paper reform proposals and a gradual move towards phasing out the work capability assessment. Once the new contracts are in operation, customers will experience more consistency, interacting with the same health assessment service provider regardless of which benefit they are being assessed for. Overall, the program is taking a long-term, phased approach that will move away from the current ways we are operating, gradually and carefully. The program is currently focused on building the foundations and creating the environment to enable the program to begin to transform these services for the future.